So the first talk will be by our chief guest for the day. In fact, our hero for the day. Sir has come all the way from Mumbai for spreading awareness on diabetic retinopathy and to screen diabetic blindness. He is aiming to do a national project throughout the country and trying to screen people with diabetic retinopathy, which in terms helps to eradicate diabetic blindness. A great and novel concept. We all hope and pray that his idea is really taken up by each and every ophthalmologist throughout the globe and it goes to next level. I request past president of AOS, member of MCOA and TNOA also, welcome home, sir. I request Natarajan sir to deliver his talk on diabetic retinopathy screening to prevent diabetic blindness.
Play. Yeah. So thank you very much, and I thank Madras City Ophthalmic Association President Dr. Arulmozhi Varman and Dr. Atik, Dr. Ramesh Durraj, and dear friends, and also welcome Kasinathan, and I also welcome the physicians, diabetologists who are more required for the screening. So my dream project, because diabetic blindness free India 2025, and I wanted to say that my inspiration is Swami Vivekananda. This is taken from the Ramakrishna Mutt Tribal Center, Sakwar, which is about 90 kilometers from Mumbai, where now I have started working. So Swami Vivekananda has mentioned, first feel from the heart. Are you seized with that one idea of the misery of ruin, and have you forgotten all about your name, your fame, found any way out, any practical solution? In your quarter, there are lots of poor people sunk in degradation and misery. And I wanted to say that my father retired as the chief of the government eye hospital, and Dr. Arulmozhi Varman's father also retired before him. And they both did only government service, and I think me and Arul are doing private practice. So that's the reason when I went to Mumbai, my father said, you may be a rich ophthalmologist, but what about poor people in Dharavi? So we started working from 1988 and it continues. And you will have to go to them and serve them with your zeal and enthusiasm, arrange to distribute medicines to those who are sick and nurse with them with all care, supply food to him who is starving. And I'm happy to say that myself, and that's why badge I wear, I am a founding trustee of this Roti Bank. We are serving daily 10,000 meals free daily, thanks to my friend Shivanandan and Sushil Jivarajka, where during the migration in March to June, we served 37,500 meals a day. And I think it's not for he being a police officer. And I think the recent movie Master says, because of hunger, the children steal bread, biscuit or something. And then slowly they become habituated to steal drugs and anything. And then they become a don. So he saw how the dons were formed. And he said, we'll quench the hunger by giving them free food. I don't know how long we are going to do that, but he has collected a few crores to give 10,000 meals a day for next 3 years. And then after that, he says somebody will take over and teach with as much as lies in you, the ignorant. And if you begin to serve your brethren in this wise, I tell you, my child, you'll surely get peace and consolation. And that's what I'm doing. So he is my inspiration, and right from my childhood, I have this. So Sakwar is situated on the Mumbai-Ahmedabad highway, NH8, about 82 kilometers from Mumbai, in Taluka Vasai district, Thane. Inspired by Swami Vivekananda's call to the nation, this backward area was identified in 1972 to serve people residing in about 500 villages of Vasai, Palghar, Dhanu, Vikramgarh, Wada, Jauhar, Mokoda, Bhiwandi, Sahapur talukas of Thana district. At that time, people lacked easy access to medical services, education, and even trade to earn any income. The monk and volunteers, including doctors, conducted a medical camp every Sunday near the village Sakwar, and I promised I will also work every week there. So I had the opportunity on January 12th, 158th birth anniversary of Swami Vivekananda. There's a statue in Gateway of India, and that's the Swamiji who's in charge of Ramakrishna Mutt in the Kar, Mumbai. And so my dream started as the president of All India Ophthalmic Society, combating the epidemic of diabetic blindness in India, diabetic blindness free India in 2025. And there's no financial interest to disclose. So my dream, so I want to announce, the reason is it's in Facebook and YouTube. So I believe this, and this is what Swami Vivekananda said: if you meditate on virtues inside a rock cave without windows, no WhatsApp, no mobile, everybody in the world will come to know. And I hope this is what I'm planning to do. It's my dream and vision to eliminate diabetic blindness, related blindness from India by 2025 and eventually the world. It looks impossible, and that's what Vision 2020, when in the 80s it was formed, everybody thought, how can be done? But the Vision 2020 program aimed at the 2020 vision, and that means 6-6 vision in right eye and left eye, and they gave the right to sight. And then I think it's there in Constitution of India that we should serve everybody to make them have good vision. But unfortunately, even though it's there in Constitution, which still I think we are not able to give care to every person in the country. We have 1.3 billion people, and all of them require, right from birth to death, and after death also, you need ophthalmologists. Screening is the most important step in the prevention of diabetic blindness. I would like to outline the components of my dream. Use of a smartphone. Again, I said no financial interest, to take good retina photographs. Portable, sustainable, and cost-effective equipment for screening a large population. I think Rajiv Raman has calculated we have about 5,000 retina cameras ranging from 50 lakhs to 5 lakhs. And also using a 20D lens with the indirect ophthalmoscope, which is about 15,000-20,000. And still you can do screening, and the physicians use direct ophthalmoscope. But are we screening every diabetic? Because I will come to that. So my dream is to train unskilled worker to make them semi-skilled and generate employment among the uneducated youth of India, so that you don't need this moral policing in UP. And I think you can give them employment. You don't need education. You don't need them to know English. You can read maybe Bhojpuri or Bihari or Tamil or Marathi or whatever language. And if that can be the mother tongue, they don't have to read, write. But they all handle Paytm or Google Pay for getting their food or a movie ticket, and preventing them from being burdens to the society. I think idle mind is devil's workshop. So generating semi-skilled manpower to screen diabetics. We have 6,664,369 villages in India. And I think that's my dream. And I think Prime Minister achieved, at least he can talk to all the village panchayats at one shot, and he's doing it from last year. So early prevention of diabetic blindness, screening and early detection of referable diabetic retinopathy using offline artificial intelligence model can prevent. And as a AIOS president, I made an MOU signed with the government of India to train unskilled personnel into semi-skilled worker for being a part of screening team. So Ajit Babu was the president, and that time I was president-elect, and he said, why not you do a trial in Maharashtra and prove it to us? So thanks to Mr. Ratan Tata and Tata Foundation, they gave me about 2 crores, and we have got 11 cameras. And at present, we have an MOU with the Municipal Corporation of Greater Mumbai, which we have 55 diabetic centers where they give free medicine, and we do screening using this instrument which is there. Mr. Munishwaran will demonstrate from Remedio. And this software is developed by a company called Medios, who's again one Indian and a Swiss citizen who's in Singapore has designed it, and I'm glad Remedios has bought over that company. It's a sustainable model which does not require electricity or internet connectivity to work, best for rural areas. And equipment can be easily transported on motorbike and any two-wheeler. And we have demonstrated from 2014, thanks to K. Chandrasekhar from Forus, who took my idea in the All India Ophthalmic Society conference in Agra. And this is on January 10th, on behalf of 158th Swami Vivekananda birth anniversary. We did a free screening camp using this camera. We checked the Swamijis, again, both the Swamijis. One is in charge of the Mutt and Kar in Mumbai, and the other one is in the Sakwar. and it's a beautiful village. So on December 20th, 2006, the United Nations General Assembly passed a historic resolution, and that was recognizing diabetes as a chronic, debilitating, and costly disease associated with major complications that pose severe risks for families, countries, and the entire world. So I hope somebody from the PMO and the health minister of all the states, including the union health minister, whom I have given appeal, and I'm meeting the health minister of Tamil Nadu tomorrow, where I think they should know that they can use any person to train to get use this to screen diabetic. And according to me, from the age of 30, we should screen them. If you diagnose them diabetes, you can teach them nutrition, you can teach them exercise, and you can make them look trim, and then also we have a healthy India. That means if he becomes a blind person, diabetic person, and that too young diabetic, if he becomes blind, he's a burden to the family, burden to the city, and to the state, and to the country. So I think 14th November is a World Diabetes Day. So I started in 2019 when I was president the whole month, and now I've decided to do daily screening of diabetic retinopathy with whatever cameras we have. And this is what I made a acronym, because I wanted to copy our Prime Minister. He has an acronym for everything. So this, in English, I made it STOP Blindness, which stands for Screening through Teleophthalmology to Prevent Diabetic Blindness. And in Hindi, from the movie Gurudutt, released in 1962, where Lata Mangeshkar sang the song Jot Se Jot Jalao. That means from the one candle can light another candle, or one lamp can light. That means remove darkness around, which Jot in Sanskrit means remove ignorance around. And I think people are ignorant, and diabetes is an epidemic of the 21st century. It's a major cause of blindness in the working middle-aged adult population, and the 5th cause of blindness globally. And that has been reported in Times Magazine. And our late president of TNOA and IAOS, Dr. Babu Rajan, coined this, because we have a IMA and All India Ophthalmic Society initiative from 2013, when Dr. NSG Raju was the president of All India, and he created this. And my president's speech also, he helped me prepare. I sat with him several times in January 19, and unfortunately, he said he will watch me, because I used virtual reality, augmented reality, to bring Thiruvalluvar. Anyhow, he is no more with us, but he coined this: diabetes invariably affects both eyes, test your eyes soon. And IDF 2019, and even in 2020, there are 463 million diabetics, and 79% are adults with diabetes. 1 in 5 of the people who are above 65 have diabetes, and 1 in 232 million people with diabetes were undiagnosed. Diabetes cost 4.2 million deaths. And I think it looks scary, but nobody seems to be bothered. And the global prevalence, 415 adults having diabetes, and it projected in 2040 it will become 642. And what are we doing? And everybody's talking. And there is a publication in Lancet in 2016 which mentions if they don't take care, I think the country's economy will go down, because money will go in treating diabetic complications. So according to the International Diabetes Federation, India has 77 million diabetics. 58% of them do not know they have diabetes. So that's my dream, so that every village, if you start screening, I think we can diagnose diabetes, maybe you'll see eye changes, and also arrange for strips to check PP sugar and HbA1c too, so that we can, this is going to go by 2030 to 101 million. And by 2045, 134.2 million. I think they are all extrapolated statistics, but I want everybody to think, not only ophthalmologists, not only any MBBS doctor, but even the public, and also the public health people. So we recommend primary checkup at the time of diagnosis in every person, because I still remember my professor of preventive medicine who was shouting at me, sitting in the last row and laughing. He said, "One day you'll remember me." I remember him now. The reason is, he said, prevention will be the your important thing to do, so that you will increase your practice. For, in spite of doing all the things by Vision 2020, even today we have people having eye problem, even have refractive error. We have, but if you didn't have the Vision 2020 program, and maybe we wouldn't have had a cataract surgery rate increasing. And I'm glad to say India does 6 times more than China in doing cataract. And I think even though they are supposed to be advanced in AI, I think they invited me to talk on AI in diabetic retinopathy. And I don't know, Shanghai, maybe they are doing, but we don't know what's happening in the rest of China. And this is a movie to prevent diabetic blindness. I'm glad All India Ophthalmic Society collected about 25 lakhs and made a competition with the International Advertising Association, which is a very prestigious association for all the advertising companies. And the first prize was 25 lakhs, and a company called Madison from Mumbai got it. And this movie was released by Vijay Amritraj and Andrea Agassi, the tennis star, in Cochin in 2019, and I was there. And this is a simple movie which gives. The President of All India Ophthalmic Society, I would like to thank the International Advertising Agency for starting this competition for making a campaign on preventing diabetic blindness. And I also like to thank Allergan for the generous support to make this public initiative movie to create awareness on diabetic retinopathy and how to prevent diabetic blindness. So this is the Stop Blindness program by All India Ophthalmic Society. So this is what I want every doctor to have. Are you a diabetic, hypertensive? Do you know you may go blind?
The world will forgive you, but will you forgive yourself? Diabetic blindness is preventable. If you're diabetic, you need a retina checkup to prevent vision loss.
This is a public service initiative where only to get this slogan we paid so much, but I think it's worth it. So the main thing is the world will forgive you, but will you forgive yourself? And diabetic blindness is preventable. And if you're diabetic, you need a retina checkup to prevent vision loss. So I think we just say that you take a retina photograph, and then by that you can use AI to diagnose many things, because you can take an optic nerve photograph, and then we can have even the one day probably we can predict ischemic heart disease as told by Sundar Pichai, because you can study the only place where you can study the blood vessel directly. In others, physicians can only feel the blood vessel or hear the heart sounds, but in eye we can see the blood vessel directly. And also the optic nerve, you can diagnose or predict dementia or Alzheimer using AI one day, not today. There are already publications coming studying the optic nerve, which is possible. And maybe you have to combine OCT, which can be done, because I think once you have a primary photograph, our Prime Minister is talking about digital health, and this will be a part of the digital health. And I believe Tamil Nadu government has announced a program to do something on screening in all the PHCs, and they've asked for NGOs and public sector hospitals to join, which my foundation person told me. So I think the plan of action will be for everybody: screen, diagnose, and treat. And so here the process flow we have followed in our Ayush Youth Foundation in all the slums of Mumbai. We do 40 camps a month, all free. We have a pre-camp awareness. We have a 40 women social work, community health workers working. They can't speak English, but they know everything in eye, and they can speak Marathi, Hindi. And you assemble diabetics, capturing of images and uploading. And finally, you either use a diagnosis by ophthalmologist, but my idea is remove ophthalmologists, remove physicians, only have image graders who are not doctors, or offline AI or online AI like Google, by Dr. Rajiv and Dr. Actually, this remedy was first published by Dr. Rajalakshmi. And you have, unfortunately, 13 variety of diabetes. I am not going into detail, which Dr. Velayudham Pillai will talk. And I think we need a multidisciplinary approach. But if you don't know who's a diabetic, how are you going to attack them with dietitian, endocrinologist, ophthalmologist? And I think we have to first identify them. So I think the public should know, and everywhere in the newspaper should come, better primary prevention by metabolic control, lesser rate of developing and progression of diabetic retinopathy. Still, a significant number of patients continue to develop vision-threatening complications that require intervention. So, problem faced in our health system: one ophthalmologist per 1 lakh population, and low awareness or ignorance. And 70% of India population resides in rural area or urban slums. And technical difficulties faced: unreliable internet coverage. That's why Google had a problem in Thailand when they had a publication that say even the newspapers covered. But I think that's because of the internet problem and deficit in supply of electricity in many areas. Here you can charge that infrared device and the phone, and then you can use for a few hours and then again come back to the system. And then when you have an internet, you can send the images to anywhere you want. And you collect the images, the data, data of the patient, so that you can follow up, you can send reminders. Everybody's using WhatsApp. And shortage of trained medical staff. We only have 23,000 ophthalmologists as members of All India Ophthalmic Society, and about 2,000 in Tamil Nadu. So I think we can't combat this 77 million, and portability of conventional fundus camera is a problem. So, and the role of artificial intelligence, this is my famous slide, because I keep teaching my staff. Intelligence is the capacity to analyze, think, make a decision, and categorize, which is commonly lacking. So we use artificial intelligence, which involves formulating a specially made algorithm according to our needs to develop this capacity and include it in an electronic device like smartphone. Unfortunately, we only have an iPhone, but I think something is better than nothing, where we can make one day we should have kiosks in airport and railway station, like a weighing machine. They can put a coin or whatever, credit card or Paytm, and check the retina and the fundus photograph. They can get an image and send it to their own eye doctor. And according to me, the AI will assist every doctor. It's like an animal. I think you have to train and use it under your control and not be a slave of the machines or technology. So that's what I want to reassure every doctor, that AI coming will not replace doctors and will not replace ophthalmologists. Actually, at present, as I mentioned, 58% of diabetics are not knowing they have diabetes. And what is the problem in increasing our patient load by increasing that 58%? Whether they go to government hospital or a primary health center, if you screen them, I think this is a camera, and as it can be mounted on a suitable bike for transporting for screening purpose, can be mounted on any table. It is chargeable, so that you don't have to use in the hand, because I don't like the unsteadiness of the observer as well as the patient. So if you have a thing which I'll show you in the video. So this slide I made ABCD, because from that movie Anybody Can Dance, I made anybody can screen for diabetic retinopathy. That means people who are serving here or who's cleaner. And in our foundation, we have 3 sweepers who joined as sweeper. Later I have trained them, and they take fundus photograph better than me. And they send it, and then also the fundus photograph, the software is there where it will say it is 100% strength or 90% or 95, so that you know how the quality of the diabetic retinopathy is. And this also shows the stages of retinopathy, showing normal, background retinopathy, then severe pre-proliferative diabetic retinopathy, then proliferative diabetic retinopathy, traction retinal detachment, and finally you have vitreous hemorrhage. And this is the fundus camera, which you can see that any boy can. You can see this is the picture quality you get. You can see the optic disc. You can focus, and this has a software, and then you mark it right eye, left eye, and then you can take multiple disc macula, center of macula, the nasal to optic disc, and then you have a report like that. One, you can store this image, and you can apply the AI, which shows that wherever there's a lesion, that blue thing, which where it shows that there is a diabetic retinopathy, and that will pick up by the AI. The reason we don't need internet is all the images are referred in the iPhone itself, and that's why you don't need internet for using the AI. And it can have any number of fields you want. And this is a clinical stage. My idea is only to say that anybody can screen. And this is a comparison. We have it on the fundus on phone and the Zeiss camera. The fundus on phone is about 4 lakhs, and Zeiss can be from 25 to, there's a handheld, which is about 7 lakhs. And the other major ones are 35, 50 lakhs, because it also has angiography. You can't do angiography with this, but I think we are talking about screening, and you can see that you have the non-proliferative diabetic macular edema, proliferative diabetic retinopathy, and proliferative diabetic retinopathy with pre-retinal hemorrhage. So we can get all the information. And then this is example lesion detection by offline in a patient with mild null product. So wherever there's a lesion, it's covered by a blue, and that's what it detect, and it'll say it'll refer to the eye doctor or no need to refer. So my idea is if we screen 100 people, only 5 people maybe need to refer to the eye doctor. So 95 have to go back to the physician and not to the eye doctor. So that means we are increasing the chair time. That means when a patient comes to a diabetologist, you spend time on diabetology, and you go to a dietitian, they can talk about diet rather than doing everything in one place. And this is the again the how it can work, how automated uploading of images and central server. So so we did a study. We had a question. This is a research question: is AI reliable to pick out those in need for seeing an eye doctor? And then this is what we published. Thanks to our co-workers, Dr. Radhika, Ashwini, and Shobha Shivaprasad from Moorfields. And the similar thing without AI, Dr. Rajalakshmi has published, and Dr. Rajiv have published a lot. And this is the original publication, Diagnostic Accuracy of Community-Based Diabetic Retinopathy Screening with an offline AI system on a smartphone. And I think this was taken in the American Academy of Ophthalmology. Unfortunately, it's the #1 ophthalmic association in the world, which also said that this is not a future, but is already available now. And they had a separate thing by Alvin Liu and Dr. Sharon Solomon and others from Johns Hopkins have recommended it. And they're the first of its kind in the world using of offline AI for screening diabetic retinopathy. And we have used non-trained people and trained them and given them one skill. And now the Skill Corporation of the part of the National Skill Development Corporation under the Prime Minister, they can give a 3-week course and then give a certificate so that they can earn money legitimately, and they can have the pride that they are helping health for India. And this was the pilot study. Now we have done thousands, 231 out of 255 consented for the prediction of RDR, an average diabetic duration of 5.5 years. Patient with no diabetic retinopathy, 187. According to ophthalmology, we also compared that. And AI found 172 patients with no diabetic retinopathy, which means 8% were overdiagnosed by AI, and it's in a way better than not diagnosing them at all. And we are happy. This was the most viewed within a month, most talked about article of 2019. We have 4,004 views, and most viewed in the 30 days, and most cited in the last 3 years. And the reliability rule out non-diabetic cases drops to 81.9% when the 4 images are also included. But referable diabetic retinopathy still correctly marked as referable diabetic retinopathy with 100% reliability. I think that's what we are looking at. Where when we overdiagnose a patient, maybe 1 or 2 patients will come extra to the eye doctor clinic. But if you don't diagnose at all, nobody will go to physician nor eye doctor. So this is again the reliability of AI is to referable is 100%. And the advantages of using AI, early referral for referable diabetic retinopathy cases, greater awareness about diabetes, its effects and importance of regular follow-up, great chair time to the patients in front of the doctors, eye doctor or a physician, timely medical surgical intervention to prevent complete loss of vision. In '88, when I was in Shankar Nethralaya, I went and attended a conference by Peter Hamilton and Denek Dreger from Moorfield. And I remember Peter Hamilton looked at me and said, we will do pan-retinal photocoagulation and totally remove the role of vitreoretinal surgeon. It's never going to happen because we will, in spite of doing everything, there will be one patient with no retinopathy and one patient will be blind with retinopathy. So I think glaucoma also. So I think we have to aim at screening, even though we are aiming at 100%, I think we'll land somewhere. So that's why I remember the Swami Chinmayananda's lecture in 1977 in Madras Medical College. He said, if you want to do MA, you should, if you want to do MA, you should aim at PhD. And if you want to do BA, you have to aim at MA. So that means you have to have aim sky high, then you will drop somewhere near the ceiling. If you aim at ceiling, one day you will jump and touch it. And this gives opportunity to more working hands, then each individual citizen can proudly say, I'm working for the country, and skill development of less educated. So trained, and this is the points I wanted to drive down, trained and employed youth of India, even with minimal education and no experience in retina photography, to reach out to save vision of millions, independent of electricity and internet supply, better examination time to the referred cases, timely treatment to prevent diabetic blindness. So I want all of you, whether even the doctor, not a doctor, IMA, Rotary, Lions, everybody to join, and join hands for this monumental revolution, fight against blindness from diabetes. I'm also glad to say, when I was doing this, I decided that I should go address the South America, and I'm happy the ophthalmologists came from Brazil. They have taken this camera as a research, and they are doing it there, and also from Dr. Geeta from Geeta Menon from UK, working in Zambia, has taken this camera. And also I myself spoke to Dr. Nitin Verma, and who's now the president of Royal Australian New Zealand College of Ophthalmology, who has taken me, and I said I will come and work there in East Timor, which is the youngest country in the world, got its independence in 2000, otherwise ruled by 400 years by Portuguese and 25 years by Indonesia. And I think they didn't have a single ophthalmologist in 2000. So they have formed a program called East Timor Eye Program. The reason I'm telling this is what Swami Vivekananda said, that don't look after only yourself, your country, help all other countries. So with this mission, I hope, and that's how we established this NGO, thanks to my good friend, Dr. Abdul Kalam, who has visited me several times. One day I told him as a president, why not you come and visit us? And he gave this name, Aditya Jyoth Foundation for Twinkling Little Eyes in 2005. And he came, he asked me, what do you want me to do? I said, I want you to honor each and every staff who are working with me. He spoke to each and every one as the President of India, and it's a great honor, and he's a man of it. And again, he came in 2012. He inaugurated a van. He knows everything because he was in the board of Relly Prasad and Aravind Eye Hospital, but still he learned, he was acting as though he was learning about diabetic retinopathy from our staff. And he opened this, and then that's Mr. Shivanandan, who's also supporting this. And this is the first project. You can see the Forest camera. As I know that anybody can use any camera, and I don't have any interest, but only this is convenient. That's the reason I'm recommending, and it's economical. And this is like a replica of a regular fundus camera, and you can see at that time it was, I think, 2014, about 98 years. My grandmother is inaugurating. My late father, Dr. N. Sundaram, is there, and my friend Shivanandan, my Ravichandran, Dr. Radhika are here, and Mr. K. Chandrasekhar, CEO. This is what 1st March we inaugurated the first project in the world to carry a fundus camera on the motorbike. So my inspiration, this was in my father's car. I had seen from 1962, arise, awake, and stop not until the goal is reached. And that's my goal now. And thanks to my alma mater, where myself, I think Arulmozhi Varman and many of you sitting here, part of Madras Medical College. And I want to say this, and as a president, we celebrated 200 years in 2019, 2020, because this was started in 1819. And this is a museum started in 1919. I think India had the foresight in 1919 to have the exclusive ophthalmic museum, and first in the world and largest in the world even today, even though $12 million eye museum has been planned to open by American Academy in 2020. And because of COVID, they have not opened, but I'm happy still, even though China has made a bigger museum, that's only 10 years back in a city called Nantong. But this stands good, and I wish everybody in Madras should visit it, not as a tourist, but to be proud that Sushruta was the first Indian to do the world to do cataract surgery, and 17th century King Sarfoji did cataract surgery. Records are there in Saraswati Mahal Library in Tanjore, and Tanjore Medical College department is also 101 years old. And I'm glad my grandfather worked in 1930s there and in the government eye hospital here. So we are proud of this alma mater, 200 glorious years of modern Indian ophthalmology. And I calculated as 150 years of service to the nation by grandfather, my father, and myself. And I thank the Madras City Ophthalmic Association for the opportunity. Thank you very much.